What causes articulation omissions in speech? Imagine trying to say a word and suddenly missing a sound, like saying "ka" instead of "cat." That's what we call an articulation omission. These errors happen when a child leaves out or fails to produce certain sounds within words. It might seem simple, but understanding what causes these omissions can help us support children in developing clear speech. Articulation omissions are mainly motoric errors. This means the child knows the word but struggles to physically produce all the sounds. For example, if a child says do instead of dog, they might be omitting the final consonant sound. These errors are often linked to difficulties with the muscles involved in speech, like the tongue, lips, or jaw. One common cause is neurological issues. Conditions like dysarthria, which involves weakness or poor coordination of oral muscles, can lead to omissions. Children with oral apraxia also have trouble planning and executing the precise movements needed for speech. They might know what they want to say but find it hard to coordinate their mouth muscles to produce all the sounds. Physical structures can also play a role. If a child has a cleft palate, it can interfere with how sounds are made, especially nasal sounds. Dental problems like missing teeth or misaligned bites can prevent the child from positioning their tongue or lips correctly, leading to sound omissions. Tongue tie, which limits tongue movement, can also cause a child to omit sounds rather than attempt distorted ones. Hearing is another big factor. If a child cannot hear well, they might not pick up on the sounds they need to produce. Hearing loss makes it hard to monitor their own speech, so they might omit sounds because they don't realize they're missing them. Ear infections during critical language learning times can temporarily affect hearing and cause omissions. Developmental delays are also common. Young children are still learning how to coordinate their speech muscles. If their motor skills are slower to develop, they might omit certain sounds until their muscles mature. Limited exposure to language or early speech experiences can delay sound mastery too. Premature birth or pregnancy complications can impact neuromotor development, leading to later speech issues. Genetics can influence articulation errors as well. If family members have had speech difficulties, children are more likely to experience similar challenges. Some genetic factors affect how the brain and muscles work together, making it harder to produce sounds fully. Environmental factors matter too. Stressful or busy home environments, high parental expectations, or frequent interruptions can interfere with speech learning. Starting school or other big life changes can temporarily disrupt speech patterns. If a child doesn't get enough practice or support at home, they might develop omissions. Sometimes no clear cause is found. These are called idiopathic cases, where the child simply hasn't yet mastered the motor patterns for certain sounds. Their overall language skills are fine, but their motor execution is incomplete or inconsistent. When speech pathologists assess these errors, they look at many factors. They check the child's oral motor skills, hearing, structural anatomy, and developmental history. They also observe how consistent the omissions are across different words and sounds. This helps determine the root cause and guides the best treatment plan. Understanding what causes articulation omissions allows us to support children in developing clearer, more complete speech.